stuff, shoulder pain. We have a lot of registrant, but maybe because of the weather or whatever, they didn't chose not to show up. But this is going to be a good workshop. So when you are here, you probably are here for a reason, and you have a lot of questions. Okay, but if you want me to answer question in your way, it will be a little bit difficult. So I'm going to give you a lot of information. Actually, it will be a lot. Some of things you probably already know, and some of things you probably don't know, but it is going to be a lot more information. So we get it started. So let's introduce ourselves. Just tell your name, just your name.
I'm Bill Hammerhand. I come to Synergy for neurological issues. And I have actually already had a shoulder replacement. So, but I'm sure I'm going to learn something.
Okay, that's all right. And you?
I'm Joan, and I haven't been here before. I haven't been here before, but I have arthritis, and I've had various and sundry different kinds of therapies.
My name's Tom. Never been here before. Just want to learn more about shoulders and how to take care of them.
Okay, that's good. So we are here for the shoulder pain, okay? So before we talk about the shoulder, we have to clear up few things, okay? Make sure that unless we understand the basic few things, we really cannot move forward, and it's not going to make any sense, okay? So we will go with first one, which is very important to understand, okay? So most of the time, we think if we have more pain, we have more problem, right? So if you have no pain, we don't have a problem, correct?
That's what you hope. That's what you hope.
Hope. Is that right or
Not
wrong?
necessarily true. Not necessarily true.
Yeah, it is actually never true. So pain and problem, they are not actually related. Sometimes we have pain, a lot of it, but actually the problem is very little. Like for example, if you twist your ankle, you feel you are dying. I don't know about you. I twisted my ankle. My daughter has twisted my ankle. She's a runner, going to die. And many serious problems actually do not start with the pain. Like for example, like cancer. By the time you experience pain, it's not because of the cancer, something else is going on, okay? Which is related down the road. And by the time it's kind of late. So this is something you keep into mind. Yes, pain is a big motivator. Like if some bump happened to your skin or something, you're not going to care that much. You can wait for a day, 2 days, months. That I have seen. Or if your balance has a problem, you're falling, it's a freaky accident, I'm not going to wait too much. But it hurts, and it hurts bad. All kind of bad things get to your head. If you're hurting around this area, am I getting a heart attack? If your stomach is hurting, oh God, what's going on? So anything like that, it happens. So pain is a big motivator, I understand. But basically, when you are talking about musculoskeletal pain, that is little or no thing to do with the overall problem. Okay? Now, number 2. Number 2 is that you hurt, right? So if you tell somebody that you hurt, what is the first question they ask?
Where?
Huh?
Where?
Yeah, you said, yeah, where? My shoulder hurts or my back hurts, something like that.
Or what'd you do?
What did you do? That is a great question. So what does that mean when they ask you, what did you do?
You must have done something to cause this.
Well, what's causing the pain? Did something happen that created it?
So isn't that true that if you already know what happened and what caused the pain, you would have taken care of it?
Right.
Is that right? So what did you do? So what does that mean? They're talking about trauma. Okay? Trauma means injury. Okay? So the real trauma happens, you'll be shocked to know, be less than 1 to 2% of the time. And this is something you have to remember. This is something you have to remember. Real trauma happens 1 to 2% of the time. So, can trauma happen? Yes. Trauma can happen. Okay? Like you are getting, you're driving down the road, you get into a car accident, a tree fall on you. You fall on a tree. Can happen? So real trauma actually happened to him. Okay? So that is very rare. So most of the time, people experiencing any kind of pain, it happens only 1 to 2% of the time. So how the other things do happen, I'm going to talk about that. Okay? So when a real trauma happens, it is easy to take care of it. So if you get into a car accident, everybody knows what to do. The paramedic comes, they know exactly what to do. They are trained. You go to ER, they know exactly what to do. Do your MRI, they do your X-ray, they your whatever they need to do, and they will stabilize you if you need surgery, whatever. But the problem happens almost like 98% of the time. And this is something you've got to remember as we are going along. So if you forget this, you're going to miss the whole point. Okay? So if it is not trauma, what happens? That's what I'm going to explain. Number 3. So what I said, more pain does not mean more problem, but we always relate the level of pain. It happens to us many times. People will call, he'll say, hey, I have pain for last 2 years. Now it is excruciating. I have no clue, I cannot take it anymore. So it went already 2 years, they could manage it, right? Now they cannot manage. So that trigger. Number 2, what you have done? We are talking about trauma. Now we are going to number 3. So you have to find the cause. Why did it happen? So how generally and normally they find the cause of your problem? Why it is hurting? You go to your doctor's office demanding it. You want some kind of imaging. Could be an X-ray, which is cheaper, or could be more expensive, MRI. So if you are in a bigger place or something, you can go for ultrasound imaging. So there are like different levels of imaging because you want to see what is going on with it. Okay? So now we have normal image, we have abnormal image. And the image, again, it is only valid, an image is only valid, again, 1 to 2% of the time. Now why? Because of trauma. When I'm talking about trauma, it's not necessarily a trauma, that also take any kind of active disease or disease process. Like somebody has a tumor, that also goes on that 1 to 2 point bucket, right? Or somebody might have an infection of the bone, like, whatever bone, osteomyelitis, anything like that infection, that you can see. Not only X-ray, you can do a blood test and you can see, they know exactly what is going on and they can treat you and you do okay. So I'm not talking about those. So that is something, I'll say that again and again to kind of pound on you, that's not what it is. So I'm talking about 98% of the time. So image is pretty much can show you something else because there's nothing called as a normal image. So image is inside, well, you can have a normal or an abnormal image because if you have something to compare it to. So I'm going to take his image, I will take your image, I will take her image, I will take my image. I really cannot compare because anatomically we can vary. Okay, like for example, I can tell you, like you see, these are called lumbar vertebrae. Okay, these are lumbar vertebrae. Do you know how many lumbar vertebrae generally we all have? 5. Okay, 5 lumbar vertebrae. Can you have 4 lumbar vertebrae? Yes. More than 25% of the population has 4 lumbar vertebrae, and that's normal. That is okay. That's how they're going to live. That's how they're going to die. They'll lead a normal life. No big deal. That happens. Can you have 6 lumbar vertebrae? The answer is yes. So these are anatomical variation. Now, can you have a slight curvature of your spine? That causes scoliosis. People who live all their life, that have nothing to do with that. We only worry about scoliosis if somebody is under the age of like growing age, like you're under the age of 12, 13, 14, and then we worry because they're still growing and the curvature can be big, otherwise it's no big deal. So we just treat an image. When we treat an image, we are wrong 100% of the time. So imaging actually have less value when you are talking about 90. Well, it can have a value because you are eliminating something serious is going on or not. So you do a cheap X-ray, which sometimes if you are paying out of your pocket, it does not cost more than $60 for both view, usually. So you'll find out. So no big deal. Or somebody has a fallen, so you want to see there's a fracture or not. Yes, an X-ray is good. So imaging is not usually helpful. Number 4. So far, I talked about more pain does not mean more problem. Number 2, I talk about that, X-ray MRI image actually have the less value. Not every pain you experience is trauma. Okay, so likewise, number 4. Number 4, which is a big one, we talk about body parts. So when you have pain in your shoulder, there is a problem in the shoulder, right? So you have a pain in your neck, problem is in the neck, right? So if you pain in your back, problem is in the back. Your problem in the feet, problem in the feet. But fortunately or unfortunately, whole body is connected. Our body is one. And to make things complicated, we want to disregard, we have a mind too. So we cannot really, well, somebody might say, I lost my mind. But it does not matter what you think or what you say, you have a mind too. So now you have a body, you have a mind. And unfortunately or fortunately, they are connected. But for the convenience, we treat everything as a body part because it is easy for us to bill, like, to the insurance company. It's easy for us to code, and it is easy to have a specialist, right? You have a shoulder specialist, you have a back specialist. So the left hand does not know what the right hand is doing. So we have all kinds of different specialists, right? And that is where the problem happens. But unfortunately, everything is connected, and this is what I'm going to talk about. So how it is connected and how that affects that, and then I'll talk about more and more stuff about that. So the next, we are going to talk about this one, the major part, 98% of the time, when pain is not a trauma. So if it is not a trauma, what it is? Actually, basically, it is a process. It may start with a trauma, but then the process do continue. So for example, if you hurt yourself, broke your arm or break your elbow, whatever, break your leg, then after few months, you got treated and you go do an X-ray or MRI, everything is healed, right? Still, you will continue to experience pain. May not be the same way when you break it, but you continue to experience pain. So why that happened? So the process continues. And unfortunately, The process is different for male and female. So the process how any pain develops, it starts differently. And the process begins because our body is changing. So you can say, I'm getting old, or we have, but age has nothing to do with this. So if the age is a problem, so we need to go to a point and we'll say, well, I'm getting 60-year-old, 50-year-old, I should have this pain. But you know, it is not true. Many of your friends, if you look around, they are in excruciating condition than what you are. Or you have seen many of your friends, they are in a much better shape than what you are. So age has nothing to do with this. So the change, what I am talking about, it happens first thing different from male and the female. And I'm going to touch base with that, but it has a lot more influencing factor. So what makes the change really fast, or what the change makes really slow? So the things that actually influences the change, there are priorities are there. Can you tell me what really makes the change? Just take a guess. Any guess? There's no right or wrong question. What makes the change really fast?
You talking about like disease,
Well, yeah,
diet?
well, diet is there. Yes, diet is yes. Diet is just one part, but I'm going to put it way down.
Stress.
Yeah, that is number one. Stress change. Or stress is just one part of the whole thing. So if you have a lot of negative feeling, you have a lot of anger, stress, any of these things, that actually produce more change. If I have time, I'm going to show you a video and it's going to make more sense how that change happens. So stress is one. Number two, that causes tremendous amount of change. I'm going to give you an example.
Activity?
Yeah, but I'm going to put it down somewhere here.
Anxiety.
Yeah?
Anxiety.
Well, that is up here.
Part of stress. Okay.
Well, stress, anxiety, whatever. Number two makes maximum amount of change in the medication you are taking.
I was gonna say spouse, but that goes to stress too, right?
Yeah, medication you are taking. Now, there are few medications are there. They are really changes you. Nobody ever told you that the number one medication is the statins, cholesterol lowering medication. That can mess you up. So if you didn't research anything yet, go do the research. Till today, we don't have a single evidence statins saving a single life. Okay, but that is what it is. So the American Heart Association described. So everything runs like a mill, like an assembly line. So these are the protocols. This is what it is. You are more than that. So, but actually, your body produces cholesterol. Without cholesterol, we cannot survive. We will die. So 80% of the cholesterol will produce by body anyway. So we are trying to lower the 20%. And what it does, we don't even have a clue. But the statin, they are, and I'm just giving you one example, right? One medication. There are other medications are there which can, like insulin, that also mess you up. So we can go on the number of, I'm not going to discuss all about. So medication can change stress, medication. Then we can put the rest as an overall lifestyle. Stress is also comes under lifestyle. So if you are taking care of our lifestyle, so our stress will be better. Because how you feel, it is not away from your lifestyle. That is part of the lifestyle. Okay? So all those things can put fast forward. So imagine somebody on tremendous amount of stress. So because of stress, the blood sugar, blood pressure is going high up. So they are on cholesterol, and also cholesterol is part of the whole game. So the cholesterol lowering medication you are on, then you are on diabetic medication or maybe insulin. Now you are having a high blood pressure medication. So all those things kind of putting you on a downward spiral, but your situation and your condition is not changing. So it is showing up in your musculoskeletal condition and the change to happen, okay? Now we're going to talk about the difference between man and women. So women, they are not small men, okay? So they are absolutely distinctive. And the distinctiveness, actually, it starts from the pelvis. So I'm not a forensic scientist, but you give me a piece of a pelvis, I can tell you it's a male or a female. It's that distinctive. Okay, this is a male pelvis because it's narrow. So the female pelvis is wider, 1/3 wider. So because of the pelvis is wide, so it put in a different kind of biomechanically, what I'm talking about, male and female, they are absolutely different. So if a male is having a shoulder pain and a female is having a shoulder pain, you cannot possibly treat them the same way and hope to get better. That does not happen. Okay? And again, women, they have a shorter neck muscle. There are other things are there, but I'm not going to go much in detail. They have a shorter neck muscle, okay? And they have a lot of anterior loading because of the breast, okay? So the female pelvis is not only wide, it moves. So it has to depend on a lot of stability in many, many different ways, okay? So those are the basic changes of the male and female. And because of the biomechanical differences, we really cannot treat women like men and hope to get better. Now, coming to the shoulder joint itself. So this is the shoulder joint, right? But actually, you'll be surprised, though we think this is the shoulder joint. This plays a little to no role on the whole thing. Because it's not just one joint, we will count. So most of the shoulder stability and the problem, it starts right here, the shoulder blade. Okay, and we can go back a little bit more. It is dependent on the curvature of the thoracic spine. Okay, so now to understand the biomechanics of the shoulder, let's do a test. So you can stand up, and if you cannot do it, that's fine. If you can do it, that's fine too. Just stand up. So how the biomechanics actually helps, you will see. So if we kind of make ourselves straight and lift our shoulder up, just shoulder up. Yeah, you do whatever you can do. Now we're going to bring it down. Now we're just going to hunch over slightly. And now you try to lift your shoulder up. You'll see your range has declined tremendously. See that? Okay, you guys can sit down. Sit down. So now if somebody is hunched over and I can treat the shoulder for a million years, nothing is going to change because it's biomechanically not very sound. Or imagine there are other muscles are there, these neck muscles, and these are actually accessory muscles for breathing. Because of stress, if we are not breathing out diaphragmatically, we breathe on an emergency way, this one. Or somebody has a COPD or they're a smoker, they will use all these things. So this area is always elevated, so obviously they are going to have shoulder pain. So going back to the original thing, shoulder is not one joint. We think this is the shoulder joint. This is where they put the shaft. This is where we worry about, what. But it starts with the scapula. This is number one, part of the shoulder joint. And we can consider number two. This is what we cover number 3, number 4, and we can talk to number 5. So the whole thing acts as a complex. And in Olympics is going on, there's a program is going to go on, it's already gone, or it's going to coming up, I don't know. They call it synchronized dancing. They do that in a pool, right? So the whole shoulder complex, it dances with synchronizically. So if something else is not moving, so nothing else is going to move. So we focus so much right here, then we forget everything else. Then we think, why my shoulder is not going to get better. So by the time we see somebody here for the shoulder pain, they have been there, done that, they sometimes have surgery, they already take injection. So that is the basic biomechanics of the shoulder joint. So if we don't understand that, then we stuck with what we think and what we know. And now we have other issues going on. Now we are trying to fix the shoulder, and it is not going to work. It does not work that way. So the next one, basically, I'm going to talk about, and there is another biomechanical thing too. It is very important. So actually, I can talk about this for a long time, but I actually no time. There is a big band of muscle. It actually goes from the bottom of the thing and goes all the way to pelvis, right? So if something is going on in your pelvis or in your back, it's changing for here. So we have two key areas. Is number one here, and number two is somewhere around here. So one is changing, other is going to change. So anybody who have shoulder pain, which develop over the period of 9 times, 98% of the time, they had to have some kind of back tightness. May not be a pain, because unless you have pain, you are not going to recognize that. Remember, I talk about when the level of pain is not high up, we are not going to see, because we always want the immediate problem to be solved. That's what I see every single day. People say, you know what, I have back pain for 30 years. I don't want anything to be done about it because nothing can be done. My neck is hurting so bad. I want you to fix it. Okay? So that's what it is. So the basic biomechanically, to understand this, we need to understand this principle. So if I take a sharp sword or a knife and I'm going to cut from here, anything above right here, the lower border of scapula right here, up. This we call as the upper quadrant. Okay? This is just for sake of conversation so that you understand. We call this as the upper quadrant. And anything below here, we call that as the lower quadrant. Again, I can cut here, then you have left and right? So the rule is, if something changes in your body, everything has to follow along. So it's not just one thing. This is the reason why taking MRI gives you a false notion, false positive. It does not work. Okay? So everything follow along with that. So before you have shoulder pain, when there's an upper quadrant problem, somebody might have neck pain or they might have a headache for 10 years. Then the headache is better. Now they are having neck pain, but it's the same thing. The symptom is changing. Now the neck pain is better. Now their left shoulder is hurting for whatever reason. But you can see when one scapula is changing, we have a lot of muscles around here. It's a skeleton. Unfortunately, I don't have the muscular model. So everything, if something is changing here, don't think nothing is happening here. So if somebody has a shoulder pain today on the left side, don't think nothing is happening on the right side. It is matter of time. Okay? So that's how biomechanically we are connected. So if one thing changes, like if somebody had a leg fracture or maybe they have some kind of injury in the knee, it is going to throw off you completely biomechanically. So unless we kind of take care of it, this is why I'm a therapist for 30 plus years, and we have this, you know our name, Synergy Therapeutic Group, right? You heard of our name before? Synergy Therapeutic Group. Do you know the meaning of synergy? Produce like twice as much, 3 times as much. So synergy cannot be more explained than our own body. Okay? Because that's how the nature is designed. Nature is what it is. It always works in synergy. Whole nature is synergy. So you mess around with one thing, everything else follows and everything gets messed up. So we treat people basically, this is why, so many people, they come here when they have lost all their hope or whatever, because we go back and treat them holistically. So we look at them as an individual, not as a body part, because that is the only way. That I have hard time to figure out because I went to school a long time to study physical therapy, and that schooling actually messed me up. So I have to unlearn a lot of stuff to learn the right thing. Then it took me another 15 years to learn to do things in the right way, not the traditional way. So we stopped doing traditional therapy. Means I personally stopped doing traditional therapy for 25 plus years. So we don't practice that around here. So when I talk so much thing just to take you to the basis of the diagnosis. What is the common diagnosis, if that is real, that is bogus, so that you can relate to. So this is what I have done so far, is just the foundation. Making sense? Okay, so this is the foundation. Now we are going to the diagnosis, okay? It is real, not real, what the heck is going on here? So number one diagnosis. And obviously, it is a bogus one. People will say, you pulled your muscle. You heard that before? Pulled muscle? So actually, a muscle cannot be pulled. You say, what the heck are you talking about? Muscle cannot be pulled. I heard that. Doctor, they use muscle cannot be pulled. Why the muscle cannot be pulled? Because it is a contractile structure. It contracts and it relaxes. So you really cannot pull something contracts. If you pull, it's going to fight you back. Well, can you have muscle injury? Yes, you can have muscle injury. That does not mean. And the muscle injury happens, number one, because of a direct trauma. Another thing happens if your bones are not very good, so the muscle can pull and you can have a avulsion fracture. So you take a chunk of your bone, if it contracts so hard, it can happen when many times, many older people, I have seen their bicep is kind of bunch up. It got pulled from here and it took the bone chunk, and that can happen. But that is not called muscle pull, okay? But can you have a muscle spasm as a protective spasm? Yes, you can have, all right? So that is a protective spasm. That is not called as a muscle pull. So if you are young enough and you look healthy enough and you walk into the doctor's office and they'll say, well, my shoulder hurts. No, you probably pulled a muscle. That is a quick diagnosis, easy. You get some over-the-counter medication, whatever, and that you are all good. Now, the problem with the over-the-counter medication, we have two kinds. Usually, you have a ibuprofen, Aleve, Tylenol, something like that. Now, what is the problem with taking those things? Like, for example, ibuprofen. It is anti-inflammatory, right? You probably ingrain your head when it hurts, when it is the inflammation, I need to take anti-inflammatory. Now, the problem there is the first stage of healing is inflammation. So if you work in an office of your house, have any system of fire alarm or sprinkler system, so that is your first protection against fire. So if you are sleeping in the night, so some smoke happens or something, the fire alarm goes off, right? Or if you have an office, the sprinkler system goes off allowing that. Some office, if it's a big building, they usually have a sensor. It is going to put notification to this fire department, okay? If it is a city hall or some kind of big important building, they will get notified by the time you get fire alarm. And this is what is the main purpose of inflammation. Now, you can fire alarm go off, you can turn it off and go to bed. That's a wonderful idea. So when we are taking the inflammation, that is exactly what we are doing. So when you do that, our body can heal itself. But when we keep throwing monkey wrench on it, then we blame on everything and everybody else. That does not work. Okay? So that is what is all about muscle pull. Okay? Number 2. So that could be billion diagnosis, but I'm not talking about the real diagnosis. Fracture, tumor, other kind of stuff. I'm not talking about that. That is not my of content. Because most of the people, they don't suffer, and most of the people they come here, they are more interested on the 98% of the time. Number 2, give me a diagnosis. Arthritis. Okay. So if you cannot really find anything, or you on an X-ray you see some bony changes, you call that arthritis. But we have a lot of medical journals for a long time. So having bony change does not cause pain. Okay? We have almost like 60, 70, 80 years worth of random tests happen. Like they will pull 300 people, sample 1,000 people, medical student, 10,000 people, and they do random X-ray or MRI. And they will see some bony changes, and they will ask, do you hurt or you don't hurt? So many of them, they show bony changes, but actually it does not match up, whatever they are saying and all these things. Well, arthritis can cause shoulder pain. Yes, you are right. But the thing is, when we are talking about arthritis, somebody tells you, they are talking about osteoarthritis. That name has been changed long time back. When we are talking about itis, it means a real inflammation is going on. And that can only happen in case of a rheumatoid arthritis or in a psoriatic arthritis, which is an autoimmune disease. And those are, again, falls to 2 to 3% of the population, or maybe not. That time you do not hurt big joint. That time you hurt mostly smaller joint. If you have seen people having like rheumatoid arthritis or something like that, their hand has been destroyed so much, they will pretty much cripple. So that time you don't worry about bigger joint. So if somebody is talking osteoarthritis, again, osteoarthritis can rarely happen, and it happens or you have a problem with the osteoarthritis only on weight-bearing joints, especially in your hip or on your knee. But most of the time when you have hip or no knee, the pain is not usually because of the arthritis itself. Every day I treat a lot of people, they've already been through total hip and total knee replacement, still they're complaining of pain. So if that is the case, so they have a new hip and knee, why they are complaining of pain? That is my question. So arthritis is number 2. Number 3, another good one. Anybody? Tendinitis.
Tendonitis.
So why did the tendon decide to inflammation? Well, there is some truth to it. Yes, that tendinitis can happen. Remember, I was talking to you about biomechanically. So here, all the muscles and ligament and everything, they works on a pulley system. Okay. So imagine, like, those people, the biggest catch or whatever, when they throw in the big crab parts and they pull using a pulley. So imagine these are heavy crab part, they are pulling the line over a pulley, and the line is not on the pulley, is outside. So it's going to create a lot of friction because they're pulling really hard. That is a heavy thing. So it is going to create friction. So if when you are biomechanically not sound, imagine you are doing like this, you are doing some kind of exercise or you are using it, but you are biomechanically sound. So over the period of time, yes, you can create some kind of tendinitis, right? So that is a possibility, okay? But then again, we have to go back to the biomechanical issues. Number 4. Give me another one. Another one, actually, there's one lady, she called me and she was supposed to be here, she's not here. Unfortunately, she was not yet diagnosed yet, but I already know. There is another thing called the frozen shoulder. You heard of that, frozen shoulder? When you have, first thing you notice excruciating pain, next thing you notice you cannot move your shoulder, or you cannot scratch your back, put your bra strap, or anything you do, cannot tuck your pant, you are a man. And again, the frozen shoulder usually rarely happens to men. It's only happened to women. Because hormone plays a huge role how our body is changing. So in male, it plays some role, testosterone. In female, the estrogen and progesterone. So when the hormones started bouncing, so the main changes happen to the key area. So that is there. So the frozen shoulder is the whole thing does not move. Okay, it is an excruciating condition. So what happened when the hormone is changing, you are changing like that. So your shoulder is becoming unstable. So your body is trying to create stability to an unstable joint. So it can only make it stable by creating fibrous tissue, right? So it can create fibrous tissue through inflammation. So it's creating inflammation, so it can create fibrous tissue, it can stabilize the joint. So that is another one. That is another diagnosis is there, frozen shoulder, right? So that is there. So if you are, nowadays, luckily they don't do much. Even if still I have seen few orthopedic surgeons, they put you under anesthesia and they forcefully move your shoulder.
Manipulation.
And then after that, that person goes through the hell. I have treated a lot of people after manipulation under anesthesia. That is, in my opinion, barbaric. Actually, I have seen long time back being done in a OR. But that was a long time back. So that is what it is. Okay? So we are good so far.
Do you think a lot of scar tissue creates some of that frozen shoulder?
No, the scar tissue is not that. You are talking about fibrous tissue. Scar tissue can be only made through a surgery.
Okay.
A fibrous tissue your body makes
Right.
to make things stable. So scar tissue is pretty much useless. You cannot break it. But a fibrous tissue can be broken with proper treatment, but it has to be gentle and you have to go with the biomechanical principle. So those are the two different things. So we should not get confused with fibrous tissue with scar tissue.
Gotcha.
We say, well, that is fiber, this is fiber, what is the difference? That is morphologically a lot different, and I'm not going to get there because this is going to be a long discussion. So that is what it is. So far, any questions so far? No. Okay. So how much pain you are having today?
About the same as every day. It's been pretty bad.
What do you mean by pretty bad?
You
want to come over here?
I can
Take
reach with my right hand to pick up something.
Okay, take your shoes off, come over here. Let's see what's going on with you. So that is pretty painful, right?
Oh yeah.
So if you have to move your shoulder like that?
Oh, to turn the light off on the bedside table. I
It's very
pretty much
painful.
have to turn my body and use my right hand.
Very
It's painful. If I try to.
like if somebody is taking a shot. Or they are doing like standard therapy, they do hot pack, cold pack, this, that, yeah, it's going to temporarily feel better. But the next time when they experience pain, it is going to come back as a vengeance because the process never really stopped. So the process actually goes like a box. So you can imagine like a box. So the box is going to move forward. This could be, you could be here 30 years back, maybe 10 years back, maybe 15 years back. And how you are going to go to here, it all depends. What do you eat? How much stress you have? What kind of medication you do? What surgery you have? So slowly, when they get cornered here, nowhere else to go, everything done, that's the time they usually come. It's
I feel a
totally-
little bit more lightheaded after that one.
Yeah, because when you move things around, that exactly happens. You
Well,
can
like less toxins go, doesn't it, into your body?
lift your shoulder up more.
That's better.
It looks a lot better.
I can feel that.